Good afternoon, everyone. I'm Drew Hawkins, the board chair of the Reginald F Lewis Museum. And while I would much rather be greeting you in person, it is with great pleasure that we welcome you virtually to our museum and to the second annual African Americans in Healthcare Awards program. Today, we're extremely honored to recognize our awardees for their outstanding contributions to the field of healthcare, all of which have and continue to make amazing contributions both locally and globally that are shaping the world. I thank you for your impact, and I also congratulate you for being an award recipient. I would also like to thank and acknowledge our sponsor, partner, and a leader in the healthcare industry, Kaiser Permanente. We are fortunate to have Alma Roberts, the Interim Director of Community Health, as an active and valuable member of our board of directors. And together with Alma, Celeste, James, and their other amazing colleagues, we have developed some incredible programs around healthcare and leveraging some of the treasures of the museum that we have to offer. We thank them for their continued support and applaud them for their leadership in healthcare awareness and maintenance within the African American community. It is now my pleasure to turn things over to Celeste James, the Executive Director for Kaiser Permanente.
Good afternoon, everybody. It's my pleasure to be here with you today, and I'm so happy to be here representing Kaiser Permanente in this partnership with the Reginald F Lewis Museum. So we are extremely excited to bring to you today this conversation with our guest speaker, Dr. Kizzmekia Corbett and Dr. Freeman Hrabowski. We're also, of course, delighted to be able to honor African Americans in healthcare. And so it is my distinct pleasure to introduce to you first and foremost our regional president, Ruth Williams Brinkley. Ms. Williams Brinkley is our regional president since spring of 2020. She joined our region to oversee all of our healthcare and care delivery and health plan operations in Washington, D.C., suburban Maryland, and Baltimore. Kaiser Permanente reaches about 770,000 members in 33 medical centers across this region. And we are very pleased to have at our helm, Ms. Williams Brinkley. So I'd like to bring her to the mic.
Thank you, Celeste. And good afternoon, everyone. I just want to let you know how honored I am to welcome you to the second annual African Americans in Healthcare Awards, alongside our partners at the Reginald F Lewis Museum. As we celebrate Black History Month, I am reminded of the words of Dr. Martin Luther King. When the architects of our republic wrote the magnificent words of the Constitution and the Declaration of Independence, they were signing a promissory note to every American. This note was a promise to all men, yes, Black men as well as white men, that they would be guaranteed the unalienable rights of life, liberty, and the pursuit of happiness. And let me emphasize right here that this promise also extends to women and people of all genders. We gather today not only to recognize the significant contributions of African Americans to the healthcare field, but also to consider how we as healthcare professionals and community leaders are helping our communities to access those basic human rights. As we face a pandemic that has disproportionately affected communities of color, it is our duty to help build confidence in the COVID-19 vaccine and to ensure that everyone in our communities has access to it. Kaiser Permanente has been committed to fighting this pandemic, both caring for our patients and our members, and provided much needed COVID relief, such as food and housing assistance, and supporting our community through this time of need. Black Americans are nearly 1.5 times more likely to contract COVID and almost 3 times more likely to die from the virus compared with white Americans. Yet, according to a recent study from the National Foundation for Infectious Diseases, only about half of Black Americans say that they will receive the COVID vaccine. Whether it's fear, whether it's mistrust or misinformation that's causing this hesitation, we must build confidence in this vaccine to help our community move past the pandemic. We must ensure that the most vulnerable among us have equal access to this protection. This past year has revealed some very difficult truths in our society. From the moment and the movement for Black Lives Matter started to this pandemic, we have seen the impact of systemic racism on our health and well-being. This racism goes back generations, and yet we see it in those most impacted by COVID-19. At Kaiser Permanente, we have a long-standing commitment to addressing equity, inclusion, and diversity. We invest in these areas within our organization and in the communities we serve as part of our commitment to total health. We recognize that addressing equity is vital to our role in COVID vaccine distribution. We are committed to delivering the vaccine to our communities in the most equitable way possible as the vaccine supply is available. We have partnered with states in our region and across the country to support vaccinations to community members. We are honored to partner with community organizations to help educate and inform about the vaccine, as we will do today here with the Reginald F Lewis Museum. Today, we also celebrate the second annual African Americans in Healthcare Awards. Never in our history has recognizing our healthcare professionals been so important. This year, we have all watched as our healthcare heroes stepped up and remained on the front line of battling COVID-19. They cared for our patients, they cared for their families, they cared for each other, and they also cared for us. Today, we have the tremendous honor of recognizing Black leaders in healthcare who have worked tirelessly to alleviate the burden of this pandemic on our community. Additionally, today, we are truly blessed and honored to hear insights and vital information from Dr. Kizmekia Corbett. As a viral immunologist with the National Institutes of Health, Dr. Corbett was one of the lead researchers on the Moderna vaccine development. We're very proud of Dr. Corbett, and she's going to share more about the science behind the vaccine and information that demonstrates its safety. In conclusion, I would like to say, as we look to move forward past this pandemic, we can only achieve vaccine confidence in communities, our communities of color, through working together with partners like the Reginald F Lewis Museum to raise awareness and educate our community around both the safety and the importance of the vaccine. Today, I ask you to listen, I ask you to learn, and I ask you to ask questions so that you can be informed and can share what you hear about the vaccine with your friends, your families, and your networks. I challenge you to join us in continuing the pursuit of Dr. King's mission to ensure that all in our community have access to basic human rights, including equal opportunities to achieve total health. And now, I thank you for being with us today, and I'm going to pass it back over to you, Drew.
Great. Thank you, Ms. Williams-Brinkley. And again, we appreciate and are so delighted to have an opportunity to continue the partnership with you and Kaiser Permanente, and we greatly appreciate all the leadership that you all are continuing to take in so many different ways. So 2020, a year for us all that will go down in the history books as one to remember, and some things that in 2020 we'd rather not remember. Luckily for us at the museum, we had a host of positive things that occurred. And at the top of that list was being at the right place at the right time and having an opportunity to bring Terry Freeman to Baltimore as the new executive director to the Reginald Lewis Museum. Since my time is limited today, since we have so many dynamic things we have to cover, I can't come close to giving you all of her background and the extensive list of accolades and accomplishments on her resume. I will tell you, however, that prior to joining us, Terry ran, grew, transformed, and changed the National Civil Rights Museum in Memphis, Tennessee. She expanded programming, improved community connections, increased educational programs, and more than tripled their operating budget in the 6 years she was there. The words that come to mind as I describe Terry to me: smart, dedicated, passionate, creative, caring, inclusive, humble, and she gets it. But don't just take my word for it. The museum is open. Come visit us and take the time to meet Terry in person yourself in weeks and months to come. I can't say enough about how thrilled we are at the museum to have Terry joining us. Her longstanding passion for bridging communities and her clear understanding of the museum's history will transform the museum's vision for many years to come. It's my pleasure now to introduce to you Terry Freeman.
Thank you, Drew. We are so happy to be partnering with Kaiser Permanente on this most important and timely topic. The Lewis Museum wants to exemplify excellence, and today we do just that with incredibly dedicated healthcare practitioners in a year when scientists and medical professionals have become our superheroes. COVID-19 has taken a tremendous toll on humanity, but it has been particularly harsh on communities of color. Issues of access, equity, and economics present barriers for Black and Brown people while yet providing opportunity for this virus. Essential workers, those who don't have the option to work from home, who don't have an option of not working because they are the breadwinners for their family. Those essential workers that can't drive in their individual cars alone, but must ride on public transportation to get to work. Low-wage workers who may live in multi-generational homes, exposing our elders to all the people those workers interact with daily. And now, unfortunately, fear. Fear of not understanding this vaccine, but having enough understanding about their history to know that medical trials have not always been kind to people of a darker hue. This is what COVID has been for communities of color. So today we honor those who have worked to protect us and keep us healthy and safe through communication and outreach and clinical care and research and development. Today we say thank you for being our superheroes and sheroes. Reginald F Lewis was a self-made millionaire. He came from meager beginnings in East Baltimore, but he was tenacious and was and never afraid of hard work. Each of the clinicians being honored today are also tenacious professionals who are fighting a war on our behalf. We are so honored to give you your flowers this afternoon. So let's move on with our program.
My mother died when I was a kid. Graduating from high school, graduating from college, graduating from medical school. Those big life moments are bittersweet when you can't share them with the ones you love. I've been there. I know that look and that family member not coming home. Then COVID hit. No one has ever seen anything like COVID. You feel hopeless. My best friend's father died of COVID-19, then my father caught it. It was a rush of emotions. I broke down in tears. Wearing a mask, washing your hands, sacrifice those things now. If we protect each other a little longer, we can hold each other a little tighter. Because love protects us all.
Our first award category is for excellence in COVID-19 community response. The award will be presented by Dr. Tanisha Cheatham, Doctor of Osteopathic Medicine and Physician Chief for the Baltimore service area with the Mid-Atlantic Permanente Medical Group.
Dr. Letitia Gerasa joined the Baltimore City government as the Commissioner of Health in March of 2019. Dr. Gerasa believes that equitable care is a basic right and will tirelessly advocate for programs that support the overall health and well-being of all Baltimore City residents. Dr. Gerasa's special interests include obesity management and prevention, trauma-informed care in children and adolescents, and the expanded use of technology to improve health outcomes. Today, we're recognizing Dr. Gerasa and the Baltimore City Health Department for their great work in creating the Baltimore Health Corps, a coordinated response to the dual COVID-19 public health and unemployment crisis. The Baltimore Health Corps addresses the public health and employment crisis created and exacerbated by COVID-19. As part of their response in partnership with other agencies and organizations, the Baltimore Health Corps hired hundreds of displaced workers, trained them in community health work, and deployed them to the areas of greatest need in support of the city's emergency response to the public health crisis. As part of the group's commitment to racial equity, they prioritized hiring from Black and Brown communities hardest hit by the crisis, not just because they're committed to doing what's right and equitable, but also because these individuals are trusted messengers that are key to a culturally appropriate public health response. Dr. Gerasa also provided care to patients in the Baltimore community, having trained at the Johns Hopkins Hospital in Pediatrics and worked as medical director for school-based health and quality at Baltimore Medical System from 2013 to 2016. I am honored to present the Excellence in Community COVID-19 Response Award to Dr. Letitia Gerasa.
Good afternoon, everybody. I would just like to say thank you to the Reginald F Lewis Museum and Kaiser Permanente for this honor. I am so blown away that I would be considered in a category with other healthcare dignitaries that are doing such important work around COVID-19. Really appreciate the thought, really appreciate the honor, and also just want to take a moment and thank my team. I could not do any of this without the team that surrounds me, so really appreciate everyone at the Health Department who's working so hard to protect the citizens here in Baltimore City. Thank you.
Congratulations, Dr. Gerasa. Our second award category is for Excellence in COVID Mental Health Response. The award will be presented by Alma Roberts, Interim Director for Community Health at Kaiser Permanente, Mid-Atlantic States, and a board member of the Reginald F Lewis Museum.
Annette March Greer is the visionary co-founder and president of Roberta's House, a family grief and trauma support center that offers a place for children and families to mourn and heal. Roberta's House offers over 13 different free programs for all ages of individuals experiencing a wide range of losses. The organization has served more than 7,000 children and individuals since its inception in 2008. Like many nonprofits, COVID-19 presented major challenges for Roberta's House, refusing to leave Baltimore's residents without crucial grief support. During the pandemic, Roberta's House immediately shifted its grief support services to remote, virtual, online, and via telephone. Every core program continued to operate throughout the pandemic, and over 400 people were served in just one quarter. In January of 2021, the agency completed construction on the first full-service bereavement center in Maryland to serve 3,000 individuals annually and to address the grief resulting from the high mortality rates of individuals and families across Maryland. In recognition of her innovation in the area of grief and trauma, Ms. March Greer has received countless awards, including the prestigious list of top 10 CNN Heroes in 2014. I am especially proud to recognize the work of Annette, the staff of Roberta's House, and its board of directors that I am so honored to chair with the 2021 Excellence in COVID-19 Mental Health Response Award.
Thank you, Kaiser Permanente and the Reginald F Lewis Museum of Maryland for this award in healthcare leadership and excellence in the COVID-19 response. Your encouragement means everything in these stressful times to us. Our work did not cease, but intensified, and we quickly pivoted to all virtual and social platforms to support our communities in the pandemic. Roberta's House is also proud to announce during Black History Month its opening of the first constructed family bereavement center in the United States, founded by an African-American nonprofit to address the social injustice in mental health and grief support for African Americans and the underserved. We could not have done this without the support of our partners. Thank you.
Congratulations. Congratulations, Ms. March Greer. Our next award is for Excellence in Community Health. The award will be presented by Celeste James, Interim Vice President of Brand, Communications, and Community Engagement at Kaiser Permanente.
Dr. Stephen B. Thomas is the founding director of the University of Maryland Center for Health Equity, an NIH Center of Excellence on Race, Ethnicity, and Health Disparities Research. He is internationally recognized as one of the nation's leading scholars on community-engaged interventions designed to break the cycle of risk factors associated with premature illness and death due to chronic diseases. Dr. Thomas, along with his team, developed the Health Advocates in Reach and Research, a community-based intervention program. HAIR, as it's also called, has created an infrastructure to engage barbershops and beauty salons in Prince George's County, Maryland, as culturally relevant portals for health education and delivery of public health and medical services in the community. HAIR builds upon the rich and powerful history of barbers and beauticians as trusted entrepreneurs providing essential services to the African American community. HAIR services and research activities include promoting colorectal cancer screening, health and wellness screenings, the Black Men's Health Initiative, and flu vaccine studies, just to name a few. Dr. Thomas's body of work with Dr. Sandra Quinn on overcoming the legacy of the Tuskegee syphilis study contributed to the 1997 presidential apology to survivors of the Tuskegee study. Dr. Thomas is particularly interested in how the legacy of the syphilis study has impacted trust and influenced the willingness of African Americans to participate in medical and public health research. It is my great pleasure to present Dr. Stephen B. Thomas with the Excellence in Community Health Award.
It's an honor to receive the Excellence in Community Health Award for 2021. We wake up this morning with a coronavirus pandemic raging across the world, with the United States leading the way. One of the things that it has exposed is the need for completely reframing, reimagining our relationship with our neighbors. You know, far too many people live in the shadow of a medical wonderworld. Our whole effort in the Center for Health Equity has been to translate the science of medicine and public health into culturally tailored community-based interventions. It is extremely an honor to be recognized for this work.
Congratulations again to each of our award winners, Dr. Zaraza, Annette March Greer, and Dr. Stephen Thomas. Next, it gives me great pleasure to introduce Dr. Freeman Hrabowski, President of UMBC, who will be presenting Dr. Kizmekia Corbett with the Excellence in Health Research and Development Award.
Thank you, Ms. Freeman, very much. I am delighted to present this award to Dr. Kizmekia Corbett, the scientific lead of the Vaccine Research Center's coronavirus team at the United States National Institutes of Health. She is widely recognized now as a rising star in the immunology community around the world. In fact, she is in the most recent issue of Time magazine as one of the 100 most significant people in the world, the next 100 most significant people in the world. And her introduction was written by Dr. Fauci himself. And what he said was that during this pandemic, all the work that she has been doing on the coronavirus biology and vaccine development have led to this year's research leading to this discovery of the stabilized version of the spike protein that's found on the surface of all coronaviruses and is a key target for vaccines, treatments, and for diagnostics. And as a result of her work, we can say that she has had a substantial impact, according to Dr. Fauci, on ending the worst respiratory disease pandemic in more than 100 years. As a graduate of UMBC, she is our best. We're very proud of her. And most important, what we can all know is that she is the first Black woman in the world to ever create a vaccine. That should give all of us goosebumps. Dr. Kizmekia Corbett.
Thank you so much, Dr. Hrabowski. And you notice how he put according to Dr. Fauci in there. But I will say that Dr. Hrabowski is my personal PR and speak equally as highly of me as Dr. Fauci. So it is beyond a pleasure to have been introduced by him today. And to have things like that written by Dr. Fauci, but above and beyond that, to be recognized as part of this series of awards by this museum, particularly because I like to think of myself as a Baltimorean in so many ways because I spent so much time there when I was at UMBC. And my time in Baltimore actually really ignited what I think of as my passion for community outreach and actually drove me into vaccine development. So my heart is always and forever with Baltimore in that regard. I have been getting lots of awards, Black History Month, Women's History Month, etc. But the ones that stick out the most are the ones that recognize that contribution because the science will come. One thing I always knew was that I was a scientist and I was pretty good at it, and the science will come, but getting it to the people is the most important part of it. And so I am thankful for this award, and I hope that you all enjoy our conversation later. Dr. Hrabowski and I will be keying about the vaccine a little bit. Thanks again.
The reason that Jackie and I decided to participate is that we had the chance of listening to a former UMBC student, a UMBC graduate, Dr. Kizzmekia Corbett at NIH, who has actually created the vaccine.
There's a lot of skepticism, especially among African Americans, about this whole vaccination.
People often ask us if it was a really hard decision to participate in the trial. And I often say it wasn't so much hard, it was a serious conversation that we had, that so many people are dying from this COVID-19 and disproportionately large numbers of people of color. And someone has to stand up and say, no, we have to follow the science and get the vaccination.
When I talk with my friends who are skeptics about this whole vaccination process, I simply, point out that, I participated in it, I'm alive and well, it hasn't affected me.
When people say this is an experiment, no, this is the best of science coming from the most informed experts in the world who are saying our decision must be to take this vaccine. We are so blessed that we have this vaccine. And for people of color, I would tell them, look into the face of Dr. Kizzmekia Corbett. Came to UMBC, went on and got a PhD. And so there are scientists of all races involved, men and women involved in this process of the creation and the implementation of the vaccine development.
It's not just about you. It is about others that you live with, that you work with, that you talk with. Think about doing this for our community, for others, and what this might mean for them.
Vaccinate and protect the people you love. Learn more at covitlink.maryland.gov. Great. And so we want to begin with this conversation. I believe my face will come up also. Dr. Corbett, I told people to look into your face. You know, you came to UMBC as a 17-year-old Kizzy, really smart from Hillsborough, North Carolina, excited. And so when people see you now, they're seeing the scientist. But just for a minute, before we get into the science, let's have some fun. I want you to talk for a minute about who you are. The fact that you majored in sociology and biology, you come out of the South, you are a woman of faith, those kinds of things. People need to know that scientists are real people. You know what I mean? And so talk, if you would, about if you ever could have imagined you'd be in this position right now and what it means for you and how your life has changed now that you've had this discovery.
You know, I am still Kizzy. I'm still the little girl that you met when I was 17 years old and being recruited into the Meyerhoff program. And that girl was more than a scientist. Actually, before a scientist, I was, you know, I'm a Christian and I'm sassy and I'm bright and I'm fashionable and I'm all of these things, and I'm Southern and I'm empathetic and I'm all of these things that make me into this person that make me a better scientist. And so I think that is the most important part of the story in all, is that people drive the research and then people drive it further into the arms in the case of vaccinologists. You know, I actually remember saying to you or to the group when I was being to Meyerhoff, you know, I've always been fairly outspoken, and shout out to my parents for that. But you know, hi, I'm Kizzmekia Corbett, and I'm going to be the first Black woman to win a Nobel Prize in medicine. And everybody was like, okay. But, you know, that's always been my dream. And I actually used to research Nobel laureates, like their entire history, and practice a fake acceptance speech as if I was them. And you know what? It really speaks to just putting yourself where you want to be.
Yes.
And really speaking the words to the universe. I obviously haven't won a Nobel Prize yet. I don't know if I will. But I think that even just helping to save the world, so to speak, is good enough. And so I think I knew that I was going to do something and know what it was.
I hear you. And so when I think about your coming in to the program, I'm thinking about the fact that we want to convince more young women, more little girls, more Black people to go into science. And you know the Meyerhoff program is for that purpose, to go into science and medicine. It is significant that Dr. Letitia Jarrasa is also a Meyerhoff. She and her husband. So very proud of her for getting that award today. But I want you to talk a minute about the importance of supporting students in college and science, what the Meyerhoff did for you as it prepared you to go on and get the PhD at Chapel Hill and where you are now. Say something about that program and the need to support students in their pursuit of science.
You know, Dr. Hrabowski, it is simply one word: resources, right?
Yes.
It is equaling the playing field with people who have generally been under-resourced. And those are communities of colors and people from underrepresented minority groups. And the Meyerhoff program provided that. And it wasn't just financial resources, right? So, you know, people talk about luxury, but part of being luxurious is being at peace. And I remember when I was choosing between Meyerhoff and other places, my dad told me, go where you're going to be loved. And it was just so clear. It was so clear that the program, beyond whatever odd amount of dollars they provide by way of scholarship, really was a place where every single person in that program was special, where every single person in that program would be loved, where the goal wasn't to fail you out of your Bio 101 class, but instead to lift you up. And I think with that, the lessons that come with that is that community is important, because protecting your peace can only drive your interest. And that's just how it goes. And so if you're not comfortable, you do not thrive intellectually. And so the Meyerhoff program really leveled the playing field, where other people coming to college, and they're automatically comfortable because particularly at UMBC, right, it is a predominantly white institution. So they're around their peers. You know, they're around a lot of people who already speak like them and walk like them and dress like them and et cetera. You know, the Meyerhoff program provided this niche for us to just be to be comfortable, and to thrive.
Excellent. So what advice do you have for children and young people and families as they think about the possibility of considering a career in science? Before we get into COVID, just any advice you would have for the little girls who might see this one day, or the high school students?
The first thing is that the beauty of being young, if you are a little girl or a little boy or a little ungendered person, is the time to explore. And that is so beautiful, I think. So for me, I started that exploration process when I was 16 years old, really out of force, to be frank. I wanted a summer job, and my mom said, you're not going to be working at the clothing store. If you're going to do something this summer, it's going to be scholarly. And so I found a scholarly job, and I fell in love with science for that way. And what you really have to do is just start to explore as soon as possible, find out what you like and what you don't. And what wakes you up every day with excitement. And that's the biggest part. And then secondly is that one of the things that I can say as I look back on the entirety of my career trajectory is that I always had someone in the space that was looking out for me. So find those people and seek them out. And, it almost has to be intentional in a way, right? You want someone to be equally as invested in you as you are in you, because the world is more likely to care about two people than it is for one. And most certainly the world is more likely to care about Dr. Hrabowski than they were little Kizzy Corbett. So you find that person and you have them be invested in you and your success.
Yes, it's very important. So let's move to COVID-19. And, we always talked when you were in college about being a scientist who could speak in a way that people knew you knew the science, but that was clear enough that the person who doesn't know science would have some sense of what you're talking about. So I want you, to the audience, to talk about your research, the process and the path, and how we got to develop the Moderna vaccine, please.
Absolutely. So I am a viral immunologist by training. So what that means is that I study viruses and I study the human immune system, but not outside of the context of each other. Cool intersection of the two that I'm trained in. And so it's in a really critical way. And so that's where I took my career. And I got to the Vaccine Research Center at a time where MERS, which is another coronavirus, was circulating in 2014. And it became very clear that these viruses had the potential to cause deadly outbreaks. And it was only a matter of time before one of pandemic proportion hit. But there was no vaccine. No one knew anything about the viral immunology. It was really kind of a blank slate. And so we studied in really intricate detail one particular protein. And it's the protein that's on the surface of the virus, sticks out like this. And it's the reason why the virus gets into the cell. And so if you can block that, you have a successful vaccine. So we basically studied ways to make the immune system block coronavirus spike proteins from binding to cells. And so that's what we've been doing. And that's the work that has led to the vaccine that you have today, where, you get spike protein into your body via message, and you create an immune response that's very specific to it, and it blocks infection, and you are protected.
Wow, very important. And so at what point did you know that your work was going to make a difference in that process? We're going back, and I remember you made some comment about how long it would take you to actually create the vaccine. Talk about that for a moment. You were making progress, but at some point you really were confident. When you spoke on CNN with Cooper Anderson, you spoke with confidence about how things were going to happen, and I was with goosebumps. Talk about that process and how you got there.
Well, first of all, let me tell you something. I got around my timeline where but you know what? You just have to believe in yourself, and you have to believe in your work. And when God says something is in order, who am I to say no, it's not? And that's how I felt. And so I then said that back in last April, said that the target for getting to the general population would be this spring, and here we are. And the reason why I think we really knew that is because we had already at that time entered into what's called a phase 1 clinical trial. So this is the stage of clinical testing where you are assessing just safety. Is the vaccine safe, yes or no? And because we'd done that so quickly, and because we'd amassed this large network of collaborators, whether it be FDA, NIH, Moderna, et cetera, the pieces of the puzzle were there. The vaccine was there, and all we needed to do was to just prove it at each of the different steps. I had information from the animals because I was doing all the preclinical stuff that suggested that it was very safe and very immunogenic. And so we were very confident in that way.
That's very good. And I remember you're talking to me about this challenge of clinical trials, and you were determined to get to a certain percentage of the participants who would be Black. We talked about that a lot. You were texting me about that. Oh my God, we got to get there, right? And based on that, it was very clear that Jack and I wanted to be in that trial, and we did get in that trial about the summer. Talk about the importance of Black people being in the trial. Growing up in Birmingham, I'm so aware of the Tuskegee study, saw the grotesque pictures, know all that, but no, we've got to believe in the science. And I keep saying to people when they say, we don't know about the people who developed it, I said, look at the face of Kizmekia Corbett. So talk about why it's important and what % of the participants are Black and what that tells you.
You know what, Dr. Hrabowski, you didn't say, look at her attitude. I don't take no mess now. Don't mess with my people. and that's exactly how I felt. After the phase 1 clinical trial, which was conducted by us, actually at the NIH in collaboration with Kaiser Permanente, actually in Seattle, coincidentally. But there were 4%, it was 4% Black enrollment in that phase 1 clinical trial. I like to say it was the only failure that I had last year.
Huh.
And it was embarrassing. Mm-hmm. And it was not going to get us to the place where we would be able to, if we got to that point in the phase 3, be able to speak very frankly to our community and say that this vaccine is safe and effective. And so it became a mission of all of us, including the companies. They were actually very invested in this, of increasing the number of African-American enrollment and also Hispanic, Asian American, et cetera, because it's important.
Yes, yes.
You have to start things equitably in order to finish them that way.
Yes. Yes.
If we got to the point now where we're still at 4% in the phase 3s, then it would be a disaster even beginning to start to talk to people about the science of the vaccine. Mm-hmm. And so it was important. And I thank you for being in the clinical trial. My family, my friends, everyone really rallied behind me in that way. And I am indebted. Mm-hmm. But yes, we slowed down the phase 3 clinical trial to make sure that the numbers were on par with what we felt were respectable.
Mm-hmm. And we got to 10% Black participants.
10%. So a little bit less than what we wanted to be. We wanted to be around 13% and mirror the population of Black people in the country. But you know what? I have other vaccines going into trials, so we'll do it then.
And this 10%, and so am I correct? You would tell anybody, take the vaccine. Am I right?
Absolutely. Absolutely.
Yes.
It's safe and it is effective. And moreover, not just in your typical white man, but also in a Black men and women that were in the trial as well.
And I like telling people that at Moderna, one of the chief scientists there is also a UMBC Meyerhoff, Black man who's mm-hmm. involved in that process. Yeah. And Michael, you had something to do not just with Moderna though. Your platform is in others. Say something about that and how what you have is involved with some of the other vaccines, not all, but some of those others.
Right. So the information that we got from the spike protein that I was talking about in that brief description earlier, some of the really cool information that we got about how to make it a really good vaccine is patent pending, I think still, maybe in a couple of days not, but patented / patent pending. And it is being used by not just Moderna, but also by Pfizer, Johnson & Johnson, not AstraZeneca, but Novavax and several other vaccine companies around the globe developed Moderna's vaccine and actually did the studies towards the development. But our signature and our intellectual property is a lot of places.
I think so. This is my last question, and then the museum can decide if it wants to give questions, opportunities for others to ask questions. I could go on forever. We know that. But let me just ask you this. What's next? Everybody wants to know. So what's Kizzy going to do? What's Dr. Corbett going to do? What can you say? I know you can't say everything, but I know everybody wants you. Is there anything you can say? And at least start by saying, you said other vaccines. I know you're working really hard on that science every day. What are you working on right now? And what do you see for your future?
You know, I was actually bred in the influenza vaccine field. Okay. So when I got to the Vaccine Research Center, I wanted to work on coronaviruses, but coronavirus is extremely risky, especially when you think about moving into your career trajectory. Because if we didn't have this pandemic, I would be under the radar. I still would be publishing papers, but they wouldn't be New England Journal of Medicine, frankly.
Sure.
But so, you know, so I worked in flu because flu is bread and butter when you talk about vaccine development, especially next generation vaccines. And I actually have a flu product that's going into phase 1 clinical trial.
Oh, really?
It was supposed to be going now, but coronavirus. So I don't know when we've slated it for, but it's going.
Yes.
And then there are several other products that probably will go as well. And also, you know, one of the things that people don't know is my team also developed the Eli Lilly's monoclonal antibody therapy. So both the first in human vaccine and the first in human therapy came out of my team.
And what does that mean?
So, what does that mean?
Yeah, for anybody, when you say you developed the antibody, I mean, if you're not in science, I'm in math, and I still don't know.
So Eli Lilly is a pharmaceutical company, and the proteins that your body makes to fight off coronaviruses are called antibodies.
Okay.
So that's what the vaccine actually makes your body make.
Okay.
You can take it one step further and isolate those and then design them, or so to speak, and give them to people as a therapy.
Oh.
And so not only have we developed a vaccine, but we also co-developed an antibody therapy in collaboration with Eli Lilly. And both of those were the first.
Wow.
Yeah. So I'm sorry, and so what's next?
Yes.
You know what? I'm going to do science, and I'm going to do science at a place that's intellectually stimulating. And as my dad says, you know, where there's love and money.
I love it.
But you know, I'm a scientist. I see myself running a laboratory, having or running my own institution. So you know, anything is possible at this point, I think.
That's great. When you're really in your 30s, all things are possible. It's amazing. We're really proud of you. You're exactly 1/2 my age. So this is all great. And let me just say to you, we all thank you for remaining Kizzy, for remaining, while you may be Dr. Corbett, but your personality has that sassiness, but also shows people you can be a scientist and be a real person and a person of faith and care about people, you know what I mean? And communities, as you've said so many times, and about African Americans. So thank you for all of that. I'm going to turn it over and see if there are questions from the audience. So museum folks, help us out here.
Thank you so much, Dr. Hrabowski. We do have a few questions for Dr. Corbett. And the first one is, what do you say to people that say the vaccine was rushed to market?
You know, I remind people that the work that went into these vaccine concepts started over 15 years ago. So delivery of therapeutics is not news to scientists. Unfortunately, I think we've done a bad job of translating the science to people. And so I understand where the questions come from that. But these types of technologies have been in development for a very long time. And as I said, I've particularly been working on coronavirus vaccines and knew so much about how to make a really good coronavirus vaccine that there was ease into the clinic. So we knew exactly what to do with the mice. We knew exactly what doses. We knew exactly how to make the vaccine and make it safe. And so we cut off a lot of time just by being prepared. And then secondly, what you're seeing also is unprecedented in just the network of collaboration. So Kaiser Permanente running a phase 1 clinical trial from a vaccine that came, you know, from the NIH and Moderna, which are collaborating. And so you have this really intricate collaborative effort that number one, the resources that go into that are a lot. And so it takes money to develop a product, right? And then secondly, they're all hands on deck because the situation is so dire. But no part of the clinical trial trajectory or the vetting, so to speak, of this vaccine's safety and effectiveness was compromised. And certainly the scientific integrity was not compromised along the way. And so that's what I say to people.
Thank you. The next question is, how is the COVID vaccine different from the flu vaccine? And if we take the COVID vaccine, do we continue to take the flu vaccine? And also, do we know how long the COVID vaccine lasts in your system or the immunity?
Okay, I was gonna say that, okay. The flu vaccine that you take seasonally, if you do take the flu vaccine, is different in that it is a very weak virus, 3 viruses rather, but it's very weak flu virus that you get, and it basically tells your immune system, hi, this is what the flu virus looks like. So if you see that flu virus later during that season, you're protected against it. And so that's a little bit different than the COVID-19 vaccine, which is, again, just the spike 1 protein from the coronavirus given to your body via messenger mRNA or mRNA. And so those are 2 really different concepts, number one. And then number 2, the viruses are completely different. So if you think about one coronavirus and then say, for example, MERS that happened in 2014, these are cousins. Flu and coronavirus are like distantly related, 20 generations apart. And so it's very hard for your immune system to pick up on viruses that are so different, even if you've been vaccinated by another one. And so, yes, if you get the coronavirus vaccine, you should also get the influenza vaccine. I actually had my flu vaccine back in August, and then I got my coronavirus vaccine in December. And as far as immunity to the coronavirus vaccine, so, you know, one of the things that stands out to people is the flu vaccine, which you do have to get every single year, largely because of the genetic diversity in the viruses. So there's cousins in coronaviruses, but they're still pretty closely related. Like they might at your grandma's house at Christmas, but for flu, you most likely don't ever see some of your cousins until like funerals. And that's how distant they are. And they also circulate in such a way that different ones come around seasonally. And so you do have to get vaccinated every single season for flu. But for coronaviruses, albeit there are variants, I know you've heard about those, but they're still really, really closely related. And so we are eliciting really, really good and high level immunity against these viruses. And as far as we can tell, remembering that the phase 1 clinical trial started last March, so that's about a year in, the immune responses are not waning that in any way that we would be alarmed. And so, you know, you want to get your vaccine and you want to start your immunity now. And we're hopeful for the long lasting effects of that immunity.
Thank you. We have another question that came in, and that is, do vaccines affect different races differently? And what do you tell people who fear that the vaccine will negatively impact their health a few years from now?
Right. So the first question is, could vaccines affect different races differently? Yes. And that is exactly why it was important to have various people. And that's why we really tried very hard to enroll Black people, white people, Asians, etc., so that we could say very clearly, look, this vaccine works well, and it works well in everyone. And so that is what we can say. And so this particular vaccine does not affect anyone any differently than it actually, you know, older people are having better immune responses for some reason. But nevertheless, you know, the 90%, 95% efficacy that you see is good for everybody. Obviously, there's people with immune compromise and stuff like that, but on a race basis, yes, the vaccine is safe and effective for everyone equally. I'm sorry, I forget the second question.
The second one was how, like, long-term side effects.
Oh, yes. Okay. Yes. And so this is actually one of the major questions that people have. So there's the rapid development. Oh my God, dispel that by, saying we did all the work previously. And then there is, but what about in the future? But what about it? So generally speaking, for vaccines, actually 95% of any side effect that we've ever seen from vaccines in general happens within the first 2 months. And so when I talk about science driving how we are operating in this development process, that's exactly why the FDA required that the vaccine be in the phase 3 participants for 2 months before we could even submit for emergency use. So the FDA was on that. They said we need to see safety data for up to 2 months in the phase 3 before you can even say we want to put it into the general population. Secondly, remember that the phase 1 started a year ago, and those people are safe and healthy and, great. Thankful that they were first to get in because they've been, vaccinated for a year now. And also, one of the major concerns that people have with long-term effects is this messenger RNA, which sounds scary. It's genetic material, blah, blah, blah. But remembering that this technology has been being developed for over 15 years, and it's been in clinical trial for a very long time. Since the onset of Moderna, particularly, they have other vaccines that have been in clinical trial, but also for other therapeutics like cancer therapeutics. And so we know the long-term effects of mRNA in the body. The body actually knows how to handle mRNA very well. Your cells do this day in and day out. It's like boiling water for a cell, very easy. And so cells know how to recognize messenger RNA. They know how to read the messages almost perfectly. And then after that, they know to get rid of the mRNA. So the message doesn't stay inside of your cell. I've heard people make the analogy to like a Snapchat message. It goes away in 24 hours and just leaves behind the immune response that's protective for you. And so, I understand the fear, but it's just not apropos based on all of the knowledge that we have.
Thank you for that, Dr. Corbett. And I have a question from an RN who lives in Baltimore City. She says, I'm doing my best to explain the science in layman's terms. Sometimes I'm received, other times I'm not received. Any suggestions on how I can use language as a frontline worker to educate my community? And she says, by the way, I live in Sandtown and Harlem Park community.
So the first thing is don't get down and out on yourself if some people receive. I actually was like that in the beginning of this because I felt it was just like the burden was sitting on my shoulders to get so much information to so many people as soon as possible so that we could start to save lives. But, the way I like to think about it, everybody didn't hear Jesus the first time he said something either, right? So, you just hold fast, and that's what you're doing. Remain informed, which is also what you're doing because you're on this webinar. And then, touching one life in a pandemic and remembering that those people are going to go spread that message beyond to their community. Remembering that that one person is going to go get vaccinated, which has an effect on their entire community. Remembering that just touching one person in this time helps the masses. But as far as language, for me, I actually don't hit the target all the time, right? So I just had Dr. Hrabowski say, what is that? And I'm thinking I just said something very lay. But I try to use, really does help to use analogies and to pair those analogies, I wouldn't say down, but make them parallel to the audience that you're speaking to. So, analogies to family really hit home to African Americans because family is really for centuries all we had. And so it is that kind of feeling has trickled down for generations. So I like to use analogies. I like to be guide people so that they are very clear, in their questions. So people will say, oh my God, Dr. Corbett, I'm so worried about the vaccine. I'm so worried about the vaccine. And I say, well, what are you worried about? And they're just like, I just don't understand, like, what the vaccine. And I try to make sure that they know that there's a lot of things that I could say, but help me help you. So guide me to where your fear lays, because I could spend all day talking about the vaccine. I mean, doing it right now, right? But I really want to make sure that you pinpoint what someone's hesitancy is really about. So whether sometimes it's autism, sometimes it's the rapid development. So you don't always have to explain the vaccine to everyone, but just address their particular concern.
Thank you. The next question we have is, what efforts are currently being made in the laboratory to tackle the other COVID-19 variants?
Oh, y'all there? Like holding my breath for a press release to come out yesterday about that. But yeah, so the variant vaccines, so to speak. So what that means is that the message that your body gets for the spike protein, we've now incorporated variations in that spike protein into the message for the mRNA vaccine. And that's going into phase 1 clinical trial just to assess for safety. And the vaccine actually shipped from Moderna to NIH yesterday. So we are on it if necessary, but it's not clear that it's even going to be necessary. So you do see a dip in efficacy with some of the other vaccines as they compete with the variants, for example, in South Africa. But it's not nothing. There's still very respectable protection against the variants, and moreover, very, very respectable protection against the variants as it is pertaining to severe COVID-19, which is most important, right? We're not that concerned about the variants. I know that the media hypes them up, but part of being prepared is saying, listen, if it does become a problem, we got you covered because we've now tested it in a phase 1 and we're really ready to really amplify that vaccine into the population if necessary.
Thank you so much. There's one follow-up relating to the flu vaccine. Are there any, reactions, contradictions related to getting the flu vaccine and the COVID vaccine in close proximity, or should there be a gap between the two vaccines?
I think that when you get the vaccine, and you know what, whenever I feel like I might misspeak, I always say that because I don't want to misguide people. I think that when you get the COVID vaccine, they do ask you if you've been vaccinated within the last 2 months. And really the part of that is because you want your immune system to calm down a little bit so that it is in its best shape so that it can help to boost immunity to something else. So what happens when you get a vaccine is you get inflammation and all of these things happen to your immune system that really makes it hyperactive. And so if something else was to come in at that same time, it wouldn't be as effective. People say, well, why don't we just take a double dose at the same time of the COVID-19 vaccine instead of 2 doses separated? It's because you want to say hi to the immune system with the first dose, and then on the second dose, you want to just burst into without even speaking kind of thing, right? So you want to wake up the immune system, and then you want to really set it off. And that's the reason why you would want your immune system to calm down after 2 different vaccines. I mean, and that's also one of the reasons why it was so important, for example, with pediatric vaccines, for there to be ample research towards getting multiple different vaccines into children as soon as possible. So by combining them, because if you had to wait for your immune system to calm down each time, you can imagine a child would be 10 before they finished all of their vaccines. And so yeah, you don't want to get them soon after each other.
Thank you for that. One more question, and that's regarding young children. When do you anticipate young children taking the vaccine? Is there going to be trials soon, or are there some taking place right now?
So this is one of the times when if I got that question from someone I could speak directly to, I would ask them about what the age of young children, because the way that this happens is called age de-escalation. So whereby the current trials were in the 16 and up age group. There are currently trials that are happening from 12 to 16 and then downward and onward, right? So as you prove safety and efficacy in each age group, you can go down. And so the trials for the 12 and up age group are happening right now. It is expected that those vaccines could be into that age group in the general population by the end of the spring, with hopes that it's safe and effective. We are doing work in younger animals, so infant monkeys, for example, to prepare for dosing all the way down to the infant ages. And so, with time, we will get there. But I can at least say with confidence that for 12 and up, we'll be there by the end of spring.
Thank you so much for that. We have a lot of questions and that we will not be able to address today, but I know you do give, a lot of events, so we will be able to follow you, and a lot of thank yous coming through. So thank you so much, Dr. Corbett.
You're welcome. Thank you guys. This is actually really fun for me. I get to ignore emails while talking to people. So
well, we're very happy to hear that. We'll turn it over to Alma Roberts now.
I could listen to Dr. Corbett talk about science all day. Wow.
I could talk about science all day, and that's actually problematic.
Yeah. Wow, that was just awesome. Well, good afternoon, everybody. My name is Alma Roberts. I'm interim director of Community Health and Economic Opportunity and Impact for Kaiser Permanente. I am also a very, very proud member of the Board of Directors of the Reginald F Lewis Museum of African American History and Culture. On behalf of both of these organizations, I thank you for joining us this afternoon for this wonderful example of the intersection of health and culture. Let me thank all the honorees for all that they do under normal circumstances and for the tremendous efforts that they have undertaken during this unrelenting pandemic. I want to especially thank Drs. Corbett and Hrabowski for a profoundly relevant and timely conversation. How wonderful is it to have the scientists and one of her clinical trial participants share such a special and meaningful relationship. Your stories, your leadership are so important as we work to overcome the historical trauma communities of color have suffered in the name of science in this country. And let me just take a moment right here and testify. This past Tuesday, I had my second dose of the Moderna vaccine. And as was the case with the first, I have not had any side effects. I want to thank Dr. Corbett for her groundbreaking work and Dr. Hrabowski for his courage. You both made my decision easier. The recording of today's event will be made available to all of you. When you receive it, please share it freely and help us advance understanding and confidence in the vaccine in our communities, our workplaces, and our homes. Also, following today's event, you will receive a short survey aimed at understanding the impact of this event on your perceptions and decisions concerning the vaccine. The link for the survey is also in the chat if you want to get an early start. Please take a moment, take time to help us understand if this event and others that we are planning can make a difference in building vaccine confidence. Finally, the partnership between Kaiser Permanente and the Reginald F Lewis Museum is both unique and necessary. We want to bring voice and visibility to issues that bind us culturally and socially, and to those that at times create barriers to our health and prosperity. Together, we will continue to address topics that matter to you and that help us to navigate through trying times, yet hopeful times, toward healing, joy, and well-being for all. Again, congratulations to all our honorees, and thank you all for joining us in their celebration. Enjoy the rest of your day.